All right, guys. So what I'm going to do is I'm going to use ChatGPT 4.0 to create a mock physical therapy evaluation. And then I'm going to show you how HippoScribe processes this voice interaction and turns it into clinical documentation. So I'm going to use the voice controls. All right, my name's Tony. I'm going to be doing a mock evaluation for physical therapy with you. I want you to be the patient with shoulder pain. I'm going to be the physical therapist.
All right, Tony, I'm ready when you are. Let's get started with this mock evaluation for shoulder pain.
Hi, my name's Tony Maritato. I'm a licensed physical therapist, and I'll be working with you today. I just wanted to let you know I will be recording the audio from our conversation so I can make sure I don't miss any details. Is that okay with you?
Nice to meet you. I understand about the recording, and that's completely fine with me. I'm ready to get started whenever you are.
Okay, so it says here on your referral that you've been dealing with some right shoulder pain. Can you tell me how long the shoulder pain's been a problem for you?
I've been experiencing this right shoulder pain for about 3 weeks now. It started gradually and has been getting worse, especially when I try to lift my arm or reach overhead.
Was there anything that happened to start the shoulder pain initially?
I can't think of a specific incident that triggered it. It just seemed to come on gradually. I do have a desk job, so I spend a lot of time typing and using a computer. Maybe that could be contributing to it?
Sure, that's reasonable. So tell me, have you ever had this kind of injury before? Have you ever had any orthopedic surgeries related to the shoulder?
No, I haven't had this kind of shoulder pain before. And I've never had any orthopedic surgeries on my shoulder or any other part of my body. This is a new issue for me.
Let's talk about some of the actual activities that the shoulder pain is affecting. Can you give me a list of things that you would normally do without any problem, but maybe now you're having some problems with, like, for example, putting on that t-shirt or pulling up your pants? Is that causing any problems because of the shoulder pain?
Yes, a few daily activities have become challenging. Putting on a t-shirt is difficult, especially when pulling it over my head. Reaching behind to put on a jacket or pulling up my pants also causes discomfort. Even reaching for items on high shelves has become quite painful.
You mentioned that you have a desk job. What do you do for work?
I work in an office, primarily at a computer. My job involves a lot of typing, emailing, and working with spreadsheets, so I'm sitting at my desk for most of the day.
Have you been doing any exercises, or has anyone shown you some things that you could start doing for the shoulder pain?
I haven't done any specific exercises yet. A friend suggested some stretches, but I wanted to consult with a professional before trying anything on my own.
Do you feel like your range of motion is limited in any way? Are you able to reach overhead or behind your body?
Yes, my range of motion feels limited, especially when I try to reach overhead or behind my back. Lifting my arm up high or reaching around to the small of my back is quite painful and feels restricted. It's like my shoulder just doesn't want to move that way.
What about your strength? Do you feel strong in those directions of movement, or do you feel weak?
I definitely feel weaker in those directions, especially when lifting or pushing. It's not just the pain. My shoulder feels noticeably weaker than usual, which makes tasks like lifting groceries or even just raising my arm feel much more difficult.
Are you getting any numbness and tingling into the hand or the fingers?
No, I haven't experienced any numbness or tingling in my hand or fingers. The discomfort seems to be localized to my shoulder area.
And tell me a little bit about your living situation. Do you live with anybody? Is there anyone around to help you either perform your exercises or do the things that you can't do right now because of your shoulder pain?
I live with my partner, who's been very supportive. They help out with tasks that have become difficult for me, like reaching for items on high shelves or carrying heavy things. They haven't assisted with exercises yet, but I'm sure they'd be willing to if needed.
And what would you say, in your own words, are some of your goals for physical therapy?
My main goals for physical therapy are to reduce the pain in my shoulder and regain my full range of motion. I'd like to get back to my regular activities without discomfort, especially simple tasks like dressing and reaching overhead. Ultimately, I want to feel strong and confident in my shoulder's ability to handle my daily routine.
That's great. And last question, what were you expecting when you came into this physical therapy appointment today? What did you think we were going to be doing, and what would be a good way for you to feel like we achieved the expectation?
I was hoping to get a better understanding of what's causing my shoulder pain and to learn some exercises or techniques that could help relieve it. If we can identify some steps I can take to start feeling better and improve my shoulder function, I'd feel like we've made good progress.
All right, that's great. Well, let's go ahead and get started. We're going to do some exercises, and we're going to end the interview portion of the evaluation.
Sounds good, Tony. I'm ready to get started with the exercises. Thanks for taking the time to go through this evaluation with me.
All right, guys. So that was 6 minutes. What I'm going to do now is I'm going to let this audio render, and then in a separate video, I'll upload it into HippoScribe, and I'll show you what that looks like. You guys can see my training HippoScribe account. So nothing in this account is real patient information, but I want to show you how I import the audio. If I didn't record the audio natively in the platform, which normally I would, I can import the audio. So I'm going to click this little upload recording. All right. So you can see here it's uploading and generating the documentation. We'll give it just a second. And here we go. Now, this is specifically tailored to match my EMR. And effectively, if you go into my patient studio EMR, I've got a section for history of present illness. You can see here, based on the audio recording, if you already listened to that part of the video, it says, quote, the patient reports experiencing right shoulder pain for the past 3 weeks. The pain began gradually without any specific inciting incident and has progressively worsened. The patient notes an increase in pain, particularly when lifting the arm and reaching overhead. Patient works at a desk job that involves extensive computer use, which could be contributing to the condition. Daily activities such as putting on a t-shirt, reaching to put on a jacket, or pulling up pants are affected due to the discomfort in the shoulder. Patient denies any prior similar injury or orthopedic surgeries related to the shoulder. So it extracted that from the audio recording. If you look at the transcript, here is the exact transcript going back and forth between the two speakers from the audio recording. You can see here, like, comma, for example, comma, putting on a t-shirt or pulling up your pants. That's what I had suggested as functional activities that might incite the shoulder pain. And so effectively what HippoScribe does is it records the audio, turns it into a transcription, then turns that transcription into a cohesive narrative. Past medical history. The patient has no history of orthopedic surgeries and does not report any previous medical conditions that would directly influence the current shoulder condition. No past injuries or surgeries were mentioned that may impact current treatment or recovery. Current level of function, occupation. So in other words, here, the patient is employed in an office, primarily working on computer. Role involves significant typing, emailing, and spreadsheet work. The AI specifically said working on spreadsheets. It captured that and brought it into the clinical documentation. I can tell you, even though I remember that the AI said that in the mock evaluation, I never would have intentionally thought to put that in the clinical documentation. This is a perfect example of where I say it actually functions to improve our documentation, not just make our documentation quicker. And then the last part I'll read, assessment. The patient presents with right shoulder pain characterized by gradual onset, likely exacerbated by repetitive computer use and associated desk work. The pain and restrictions are affecting daily activities with occupational duties, particularly with movements requiring shoulder abduction and rotation. No numbness or tingling has been reported. Indicating the discomfort is localized to the shoulder area. I didn't say anything about that, but I did ask about radicular symptoms into the hand. The overall condition suggests tendon inflammation or possible impingement. Exactly what I was thinking, which could benefit from physical therapy focused on pain management, strengthening range of motion improvement. The patient's goal is to reduce pain, restore full range of motion, and regain strength to comfortably perform daily activities and occupational tasks. Estimated recovery will depend on adherence to prescribed physical therapy in response to initial treatment sessions. I did not do scores for LE or UEFS, so this information is not useful. But you can see here, what I would do is I would copy this, Control C, I would paste it into my EMR. I would copy this, Control C, Control V into my EMR. And I would just pull these sections over. If I had recorded range of motion, it would have included that I was just getting general information about range of motion, about strength. But it's all in how you set up your particular template and what you cue it to look for. So I just wanted to show you what something like this would look like. I honestly can't imagine working without using HippoScribe and AI scribes in general, because it's just, I can't go back. I've been in this world a couple months now, and there is absolutely no chance I am going back to trying to remember every detail, trying to write every detail in the clinical medical record while I'm listening to the patient, while I'm observing the patient, while I'm assessing the patient, or trying to remember it for after the patient leaves. Like, none of that makes sense to me clinically. So I'm never going back. And I hope this video gave you guys a little kind of peek behind the curtain. If you have specific questions, this kind of technology is appropriate for every therapist in every setting. Any therapist who's trying to remember details should use an AI scribe. Any therapist who's using any kind of EMR should be using an AI scribe. Even if you don't use HippoScribe, you should be using some AI scribe to help improve the quality and the accuracy of your clinical documentation.